Tessa, defunding big abortion has been in the news, and some people are concerned that without Planned Parenthood, women will have no access to health care. Is this statement true?
Well, no, it's not true. And we know because our research team looked at thousands of community health centers around the country, federally qualified health centers, rural health clinics, and we looked at them to see if they offer women's health. And we found 5,500 FQHCs and 3,300 rural health clinics that provide women's health, serve as better alternatives to Planned Parenthood. And so there are real alternatives out there for women who need care.
Great. So now, can you explain to me? You described community health centers. What is a federally qualified health center and what is a rural health clinic?
Yes, so federally qualified health centers are these health centers that are in underserved areas. They receive federal funding to serve low-income communities, and they're estimated to serve 1 in 10 Americans. And rural health clinics are very similar. They're in underserved rural areas. They make healthcare accessible to communities where there aren't that many options, and they're estimated to serve 60% of rural Americans. And of course, this doesn't even count all of the many Medicaid providers and pregnancy centers that also offer options to women.
Can you describe to me the difference between Planned Parenthood and one of these community health centers? What are the main services Planned Parenthood provides, and what do the community health centers provide?
Well, the main service that Planned Parenthood provides is abortion. Planned Parenthood is the largest abortion chain in the United States. According to their most recent annual report, they performed over 400,000 abortions. And of all of the services that they provide to pregnant women who are looking for help related to their pregnancy, abortion is almost 97%. And then you have
97%?
97%. And then
Wow.
you contrast that with the healthcare that's being offered by federally qualified health centers and rural health clinics. These are full service health centers that are offering care to the whole family, everything that people might need related to their health. And we focused in on those that are offering women's health care specifically. So things like pap smears, annual exams, family planning, things like that. And these are community health centers that aren't focused on abortion. They're not huge abortion chains like Planned Parenthood are. They're just local healthcare providers, local to their communities in these underserved areas, making sure that healthcare is accessible to people who are low income or might have difficulty accessing healthcare otherwise.
Planned Parenthood says that federally qualified health centers could not absorb all of their contraceptive clients. What are your thoughts on that?
Well, actually, Planned Parenthood itself has been doing less and less contraception. Looking at their past 10 annual reports, their contraceptive services are down almost 40% over the past 10 years. And in fact, there was a recent report from the Kaiser Family Foundation that found that Planned Parenthood serves about 11% of all Medicaid funded family planning clients. And this really varies from state to state. So in over half the states, they serve fewer than 5%. So Planned Parenthood isn't a major provider of Medicaid family planning in many states.
Tessa, what role does abortion play in Planned Parenthood's service profile?
Well, time and again, Planned Parenthood has demonstrated that abortion is the reason that they exist. It's their main purpose, their driving focus. And if we look at their annual reports, we see that over the past 10 years, abortions have increased by 23%. They now account for nearly 4 in 10 abortions that happen across the country every year. And they were responsible for over 400,000 abortions in their most recent annual report. So as the dominant provider of abortions in the US, Planned Parenthood is a major contributor to the US abortion rate, and abortion is central to their mission.
What percent of their services account for abortion services?
Well, if you look at the options that they provide to women who are looking for help related to their pregnancy, abortion is 97%. So a huge percentage of the services that they offer to pregnant women. We know from our research that there are so many good better options out there for women, for families who are looking for healthcare. There are over 8,800 community health centers that provide women's health care. And these are just local doctors' offices, local community health centers that are offering real health care, not abortion. And that doesn't even include the thousands of pregnancy centers around the country. So women have real options, families have real options, and these don't need to include big abortion.